Well, welcome back to another episode of The Compass. We're here with Dr. Brad Robinson. We're talking about navigating post-concussive syndrome. Some call it second impact syndrome. Can you talk to us? What's the difference between post-concussive syndrome and maybe acute concussion?
Yeah, yeah. It may seem like an odd topic for us to talk about in some ways from a psychiatric standpoint. I'm certainly not an expert in, post-concussive syndrome, but as a psychiatrist, I've done a lot of neurology training, and we see a lot of patients, and one of the reasons that I was thinking about this topic was, as is the case for a lot of these things that we bring up, it's stuff that we're seeing, coming into the office. I had somebody just recently come into the office that I'd seen several years ago for obsessive compulsive disorder. Over the course of a few years, we stabilized things, and he really developed, a lot of really great coping, and went was eventually able to get off medications and manage his OCD without medications for several years, and then had was in a car wreck, got hit, and had a significant concussion, and he had not only the symptoms, persistent symptoms of the concussion, or what's called post-concussive syndrome, but then it also flared up his OCD and his anxiety, and that's common. I mean, there are definitely mental health overlay with the post-concussive syndrome and those sort of things.
Yeah, I think that was a question I have is about those neurochemical imbalances. And are there changes in certain things that happen in the brain that contribute to those symptoms like anxiety or depression, or is it neuroinflammation? Like
Yeah,
what is the cause of that?
yeah. Well, it's a topic of a lot of research over the last few years, and so there's tons of stuff out there on the internet at this point. And so again, this isn't going to be an exhaustive review of all of that. One of the things that I would say, and part of how we've tried to focus this, is just to be some general help and information to our patients. I mean, just as a clinician. And one of the things that I would say, even to begin that conversation about what is it and what's going on, is that I do think that there's people out there, and I'm sort of, I guess, somewhat of a natural born skeptic too. And I think that I see patients and clients and families that come in and, are a little skeptical of medicine's tendency to put a label and on everything and pathologize everything. And I think that unfortunately there is some reason for skepticism about that we do tend to pathologize everything and then give it some kind of an acronym or a label. And and kind of as a clinician, how I see that is, does it endure? Like, because I've seen lots of, I mean, I hate to say it, but they're like fads. I've seen fads come and go over the last 30 plus years in medicine and diagnoses, and this or that, and then it kind of fades, and you're like, well, that doesn't really fit actual clinical practice. But concussions and post-concussive syndrome does. I mean, it really does fit actual clinical practice. So, it's an enduring thing that you do as a clinician, you will see. Now, again, before we get into more of the details, I would just want to reassure family members and parents with kids, and I don't want people to be overly cautious about bumps on the head. I mean,
Hmm.
it's a part of life. Kids are incredibly resilient, and so you know, don't be overly anxious about these things. In your own experience, I mean, if you've had a bump on the head, you don't have to be overly anxious about it. I mean, if if there's a problem, it will become apparent,
Mhm.
that there's a problem. And then, then you can be like, okay, well, maybe we do need to look at this. So again, don't be overly anxious about these things as an adult with getting a bump on the head, or as a parent with your kids getting a bump on the head. Don't be overly anxious about them. But let's talk a little bit about what it is that when you do get a significant concussion. And a concussion is a hard enough impact that the brain has, usually the thought is that the brain sits in a fluid, in the cerebral spinal fluid, and with a hard enough impact, it sloshes forward, so to speak, and forward, and then a recoil back, and you get an impact on the brain. And it doesn't, and this is where some of the research has been for, I don't know, 20 years, I don't know, but especially more recent than that, there's been a lot more, exploration of it, because a concussion, doesn't typically show up on a MRI or a brain scan or something like that. It's not a more severe brain injury where there's a, bleed into the brain, or blocking off, vasculature and blood flow to where there's a stroke-like injury. I mean, those are brain injuries that, you know, more severe brain injuries. But a concussion is a significant impact on the brain, that does trigger uh, inflammation. Is a lot of what the research is indicating, that there's a significant amount of inflammation that's a contributing factor to the full post-concussive syndrome. And then there's also, concerns about like microvascular changes, kind of shearing forces at a cellular level that may be contributing. And again, there's various research with that. You can, look these things up online. There's more details about them. There's some concern, and I think there's pretty good data that with that impact, and maybe it's related to the inflammation, but there's metabolic changes, like cell at a cellular level. There's changes in cellular metabolism, and that alter things. And so there's research going on with that stuff all the time, trying to really explore what's going on at the neurologic level. But at a clinical level, a big part of what we're looking at with post-concussive syndrome is a persistence of cognitive deficits, a distinct change in memory, a distinct change in focus and concentration. I've definitely had patients that come in that, are doing, functioning at high levels in their job. They do mental math very quickly because of their job, and they're able to, look at, oh, okay, that, here's this, and, it's something that they've done, for several years, and they can figure out, quick cognitive kinds of things. And then after a concussion, a lot of times initially after the concussion, maybe even in the first few days, they may have some headache, pain, discomfort, maybe some nausea. And then sometimes, not all the time, sometimes those symptoms resolve relatively quickly. Sometimes headache, nausea can persist, and that's a sign that there is more of a significant concussion going on. But also, one of the common signs of a more significant concussion is, you go back to work, you think everything's fine, you've rested for a day or two maybe, and you go back to work, and then all of a sudden you realize you can't, you're losing track of things. You can't do the mental math. You can't,
Mhm.
you stay focused. You begin to feel cognitively clouded and fatigued, through the day with just expending mental energy of kind of doing the things you need to do. Um, and with kids, those are school-based kinds of things, and it's maybe a little harder for kids to articulate that, but same kind of deal. There's a distinct change from baseline seemingly in their cognitive abilities, in their attention, and their ability to focus and sustain attention on tasks and complete tasks. Definitely mood changes happen too. I mean, it's very common for there to be more mood irritability, especially with fatigue, and for some individuals, a distinct increase in anxiety, panic, some depression symptoms. You can see some of that anxiety, depression symptoms even in individuals with no prior history of depression or anxiety disorders. And then certainly if there is a prior history of depression and anxiety disorders, you can see a return, just like the patient that I was talking about. He's stable for years, not on any medications. And then a lot of the same symptoms came roaring back with
And I
that.
would imagine the way that somebody got the concussion could create some anxiety too. There could
Yeah.
be elements of PTSD, right? If it was
Oh, yeah.
a car
Yeah.
accident
Car
or
accidents.
something
And
like that.
yes, you definitely see that. We definitely see that where, there's elements. And that's one of the reasons that I think in some ways it's worth talking about, because it's a fairly complex presentation in many ways. I mean, when there truly is a post-concussive syndrome going on, it's a fairly complex presentation where you're, as an individual that's suffering this, or as a family member, you're looking at it, trying to make sense out of it, because it may present with the cognitive symptoms, or it may present with the mood changes, or it may present with sleep disturbance. And so you're scratching your head going, well, is this, are they just anxious and kind of having a post-traumatic kind of reaction because of what happened? Is this neurological in its, at its core? And in I mean, it can be that whole range, but in the full spectrum of a post-concussive syndrome, it is all of the above. It really is an overlapping, complex presentation.
You mentioned that it could be called second impact syndrome, and actually made me think of this man that I knew. He's a great man. He was a wrestler and he had several concussions in the course of his wrestling history. And I think he, was having some real cognitive function disability
Yeah.
issues. Like he was running an organization and his spreadsheets weren't making sense and some of their reasoning just wasn't. And then I think he ended up getting diagnosed with CTE from that. That's repeated concussions happening again and again and again,
Yeah.
right? And
Yes.
so that idea of having it multiple times, that second impact, instead of calling
Mhm.
it post concussive, is actually sort of a pillar of this conversation in some ways, right?
Yeah. Yes, absolutely. And that's probably like maybe one clear take home message for family members and individuals is, um, pay attention to the first concussion, but definitely work hard to prevent the second concussion, especially within, a window of close proximity. I mean, I don't know that, I mean, experts in the field would probably be able to give us more details on what the research shows, but I would say really you're talking about 6 months, or even maybe as long as a year out. If you have a second concussion, if you have a significant first concussion, and you may have complete resolution of symptoms and be going along doing fine, but if you have another concussion in that closer
Mhm.
proximity, the chances of developing more chronic post-concussive symptoms is significantly higher with that second. And that's why some people call it second impact syndrome. And then that chronic, the CTE, I think, again, not an expert in the field, can't even remember. I think it's chronic traumatic encephalopathy or something like that is what
Mhm.
the CTE stands for. And, and, that is looking at individuals that have, professional football players, guys in the military, other, professional athletes, other situations where they've really had a history of multiple
Yeah.
concussions, and there are definitely a percentage of those individuals that have a really can unfortunately develop a significant chronic, well, encephalopathy, chronic disruption in, you know, the brain that impacts all the things that we just talked about: mood regulation, cognition, focus, concentration, memory, all of those things. Yeah.
Parents often are having to make decisions about their kids and what sports to allow them to be a part of. And there certainly are many good facets around discipline and being a part of a team and working together to contribute something meaningful. This is a downside of that, especially when you talk
Mhm.
about football. Do you have parents ask you that? Like, hey, do you think it's physically safe for my child to participate in this sport? Or is that a topic that you've thought about before?
Yeah. Yeah, I mean, it definitely is. And again, I wouldn't consider myself an expert on this in some ways, but I deal with lots of stuff here at the office, and I I this may be a topic, a whole other topic at some point for one of our conversations about you know how we you know sometimes I think treat our kids like they're more fragile than they really are. Like there is, I think there's a concern there where the pendulum can swing too far and we treat our kids like they're way more fragile than they really
Hmm.
are. Um, so having said that, there is reason for real conversation about, monitoring for concussions in sports, really paying attention to if there has been a concussion, and that is so hard on a kid who's really interested in their sport to really step out of the sport long enough to truly allow that concussion to heal and not be at risk for some of these chronic issues with second impact. And I think I don't know what the data is, Tyler, and some of our listeners and some people out there may know, but I don't really know what the data is. But you know, I don't. It's not just football. I mean, I think there are other sports where kids take, blows to the head. Baseball. Getting hit
They
by
have
a
it in basketball too.
yeah, basketball, cheerleading, I think I mean, these kids at fairly young ages are doing very, pretty intense cheerleading with all the stuff. My daughter-in-law, when she was in high school, was the one that they threw up in the air. I don't know what they call them in cheerleading and all that. And I mean, those kids. I mean, we see some of our patients that have been involved in cheer that hit the floor hard,
Mhm.
and gymnastics and various things. So it's not just football, and that's a part of what concerns me a little bit because with the issues in professional football, and then you hear more about, oh my goodness, well, what about football with kids? Well, yeah, but it's not just football. I mean, there's a lot of, you know, elementary age and high school age sports where there's some very real issues. Again, I'm not saying don't do the sports or pull your kids out of the sports. I'm just saying, just a reminder from a clinician
Mhm.
that over the years that I've seen this is one worth paying attention to.
Mhm.
It's not just the medical field coming up with an acronym and trying to make something a disease when it's just normal life. This is one worth paying attention to as parents. It's like, oh, okay, do need to pay attention to this. If my child is, getting, knocked on the head, and
It
even
also could help you understand behavior, right? So if they've
yeah,
had repeated patterns of behavior and you're trying to put your finger on it.
yeah,
And speaking of that, what are some of the treatment modalities for this?
yeah. Um, uh, one, Before we move on to treatment modalities, I'm a cyclist. I love cycling, but that's another thing to talk about with parents. I mean, I grew up and didn't, when I was a kid riding bikes, I never wore a helmet and didn't own a helmet, didn't even think about it. Make your kids wear a helmet, I mean, make your kids wear a helmet. Just toppling over on the bike and banging your head on the pavement, jumping back up and taking off on the bike is a normal experience of childhood, or was in my growing up, but wear a helmet. So yeah, in terms of treatment modalities, probably the biggest treatment modality now, and there's increasing focus on this, and so there are definitely other experts in the field, even here in Cape Girardeau. I mean, several neurologists that are know this stuff and work with this stuff more than I do. We've got Dr. Hunter here in the area that runs a concussion clinic, and we work together quite a bit. Dr. Steve Jordan's a neuropsychologist in town that does a lot of more detailed neuropsych evals to really tease this stuff apart and make the diagnosis. And then when you're looking at treatment modalities, rest really is a huge part of it. Like, mental rest, like, really reducing the mental workload for several days does seem to make a big difference. And I get the fact that, I mean, it's hard to get adults to do that, and it's hard to get kids to do that because they're bouncing up and, they're like, well,
Mhm.
I don't, I'm not bleeding, nothing looks broken. I'm not, and especially once the headache resolves, they begin to think, well, I'm ready to go, but maybe not. If there's still some persistent cognitive symptoms, you need to really put your brain in neutral. Not a lot of data that I know of. Some of the more, true experts in the field probably have some data out there, but I mean, probably not screen time too.
Mhm.
You're really wanting to pull away from the overstimulation of video games and constant movement and blue light stimulation, and you're trying to you know visually track and all that. No, you want to really pull away and rest and maybe read a little bit of light reading or something, but just really rest. That's a huge part of it. Now there are other treatments that are more symptomatic. I mean, treating the headache, certainly not with opiates or anything, but treating the headache with basic Tylenol and ibuprofen and nonsteroidals. I mean, you kind of may want to be careful with the nonsteroidals in terms of those effects on they reduce bleeding time. I mean, if there is a serious concern about maybe there's been some sort of a bleed, but symptomatically treating the headache, a lot of times symptomatically treating the nausea, not persistent nausea can really be severe sometimes.
Debilitating. Yeah.
Yeah, yeah, for some folks with this. So a lot of it is symptomatic treatment and symptomatic relief. Sometimes there is a place for treating some of the mood regulation stuff if it persists. Now, most of the time, I wouldn't start treating the depression or the anxiety or the sleep disturbance. I don't know that I said that, but sleep disturbance is really, really common too. A lot of times I wouldn't start treating the depression, the anxiety, the mood regulation stuff with medications unless it really has been persistent for days or maybe weeks. That's I suspect if you really look at the clinical data on that, that's debatable of like how quickly you should start, maybe some indications that you should start treatment more quickly. To me, the balance point there is you're trying to give the brain a chance to rest, and you're not wanting to introduce more like GABA neurotransmitter activity, which is inhibitory neurotransmitter activity. You're not wanting to suppress the brain anymore. You really are wanting to be really cautious, in my mind, with what you're introducing into the brain while it's trying to heal. And so I'm pretty cautious about when to move forward with medications. But there is a point when it's persistent that you want to treat those symptoms too. You want to treat the sleep disturbance, the mood regulation, maybe even the focus and concentration. I mean, there's pretty good data, even in individuals with no prior history of ADHD or anything, that sometimes treatment with a stimulant ADHD medication may really help them get back on track with their ability to focus and concentrate. So those are
It doesn't
things.
disrupt the sleep, right?
You're right. If it doesn't disrupt the sleep, but the take home message for individuals is that medicines probably really aren't the first line or second line treatment. Really, rest, physical therapy. I mean, for some individuals, some physical therapy and occupational therapy, things that just kind of begin to, even though there may be not an obvious, like, it's not like there's a stroke where there's an obvious like right or left sided weakness or anything like that, but sometimes physical therapy that just sort of puts the brain through its paces, like, okay, this is the stuff you're supposed to be controlling in terms of gross motor skills, and oh yeah, this is the stuff you're supposed to be controlling in terms of fine motor skills, the occupational therapy, even speech therapy. Sometimes this is the stuff, and you're doing speech therapy is probably more repetitive cognitive processes and rehabbing that. So those kinds of things may be helpful. And then another area where there's really good research is neurofeedback. Neurofeedback has been around for a lot of years, but in the last few years, things have gotten it's become more accessible because we've digitalized the technology. So like Michelle Rain here at our office is an expert in that area, and she's really developed some expertise, partly from a personal experience of somebody who had a brain injury, and neurofeedback was incredibly helpful in their situation. And so we definitely see folks with post-concussive syndrome and these kind of symptoms, and Michelle sees a lot of success with neurofeedback. Neurofeedback, for those that don't know, neurofeedback, like I said, it's been around for a long time, but it's basically an EEG guided biofeedback where you come in and do what's called a Q map. It's a EEG based brain map, which really shows like areas of the brain that are over or under functioning, and then it can really show communication pathways. Has there been some disruption in different areas of the brain being able to talk to each other, basically. And then with that, once she's developed that, then she can begin to develop a treatment protocol where you come in for therapy sessions, you sit with a little skull cap on. She can then set with the computer, she can set what leads are reading, which gives helps us focus on this area of the brain and this area of the brain and how they're communicating. And then she develops some protocols of repeated trials, in other words, repeated mental activities for you to do that basically retrain those areas of the brain and retrain those pathways, getting them to talking to each other again. And that's one area. Now, neurofeedback has been researched in a lot of other areas too, but in my mind, that's one area that just clinically makes sense, and the research is increasingly supporting that may be a better treatment than introducing medications into a brain that's just been knocked
Mhm.
around,
Right.
and probably has some metabolic disruptions and all those other things that we just talked about.
Well, with a better brain comes a better life. It'd be great to have her on sometime and maybe talk through some of that neurofeedback.
Yeah.
It'd be cool. She could put it on me. We could show it. That'd be really
Yeah, yeah, that'd be fun.
cool. Well, do you have any final words today about post-concussive syndrome or second impact syndrome?
Yeah, I think just again, don't be overly nervous about it. But if you are seeing some persistent symptoms along these lines, reach out to somebody, your primary care doctor, reach out to us, reach out to, if it gets to the point where your primary care is concerned or you're concerned too, there are experts in the area, neurologists. I mean, we have several good neurologists in our area. Yeah, Dr. Hunter has a concussion clinic and they do a good job there. And so reach out to folks if you really are starting to be concerned that there's some persistent symptoms. It's definitely worth talking to someone about.
Well, fantastic. Well, if you're interested in learning more, you can call 573-334-7055 to make an appointment. You can also visit us online, bradrobinsonmd.com. This has been another episode of The Compass. Thank you for tuning in, and we'll be back again very soon.